Hello, everyone. We are facing a new pandemic that is affecting the world. The COVID-19 pandemic has changed the way we live, work, and interact with each other. However, there is another pandemic that is looming on the horizon. This pandemic is the growing threat of antibiotic resistance. Antibiotic resistance is when bacteria evolve to become resistant to the drugs that were designed to kill them. This means that common infections that were once easily treated, such as strep throat and urinary tract infections, are becoming much more difficult to treat. Antibiotic resistance is a growing concern among healthcare professionals and researchers. The rise of antibiotic-resistant bacteria has been fueled by a number of factors, including overuse and misuse of antibiotics, lack of new antibiotics being developed, and poor infection control practices. According to a report by the Centers for Disease Control and Prevention, ACDC, at least 2.8 million antibiotic-resistant infections occur in the United States each year, and more than 35,000 people die as a result. World Health Organization also reports that antibiotic resistance is a global health threat with 700,000 deaths each year. Projections that this number could rise to 10 million deaths per year by 2050 if action is not taken. To tackle this issue, multifaceted approach is necessary, involving both individual and collective action. This includes reducing the unnecessary use of antibiotics, improving infection control practices, and supporting the development of new antibiotics and alternative treatment. Individuals can play a role by only taking antibiotics when they are prescribed by a doctor, following the instructions exactly as directed, and never sharing antibiotics with other. Healthcare facilities can improve infection control by following recommended infection prevention practices, such as hand hygiene and proper sterilization of equipment. Governments and healthcare organizations can also help by promoting responsible use of antibiotics, funding research into new treatments and antibiotics, and providing education on the issue of antibiotic resistance. In fact, the World Health Organization has warned that by 2050, antibiotic resistance could cause 10 million deaths per year. This is a serious issue that we need to address now before it's too late. So what can we do to help prevent the spread of antibiotic resistance? Firstly, it's important to only take antibiotics when they are prescribed by a doctor and to follow the instructions exactly as directed. Second, we need to be mindful of the way we handle and dispose of antibiotics, as well as other household chemicals, to avoid contamination of our environment. Finally, we need to support research and development of new antibiotics and alternative treatments. This will help ensure that we have the tools we need to fight bacterial infections in the future. The threat of antibiotic resistance is a serious issue that requires immediate attention and action from individuals, healthcare facilities, governments, and healthcare organizations. So I urge you to take action and make a difference in the fight against antibiotic resistance. Together, we can protect ourselves and future generations from this looming pandemic. We must work together to combat this growing pandemic before it's too late. Thank you for watching, and I look forward to your comments and thoughts on this important topic.